A hernia, big or small, it can really be a problem. Dr. Adam Kramer from St. Mary's Medical Center explains how they can happen, who is at risk, and some possible treatment options.
So a hernia is a weakness or a hole in the abdominal wall that allows intra-abdominal organs or fat to protrude out through the abdominal wall. Anybody can get them. Men typically get more commonly groin hernias than women. Women tend to get more often femoral hernias, which is also a groin hernia but a little bit lower. And anybody who's had a previous abdominal surgery can also get incisional or ventral hernia. Hernias can occur anytime in life, so we can see them all the way from infancy up to senior citizens. Anybody can get a hernia. The repairs are very safe. Typically, any hernia that's present should be repaired surgically, so there's really no non-surgical treatments for hernias, but there's lots of different types of surgical procedures. We can do open hernia repair, we can do a laparoscopic hernia repair, and now we also have a robotic assisted laparoscopic hernia repair that we can perform. Any hernia should be repaired because there's a risk that what's going through the hole in the abdominal wall could get stuck, which is called incarcerated. And if something becomes incarcerated, then it can become strangulated, and that becomes a surgical emergency. So mesh is the material that we use to cover the hole. Mesh repair is very safe. The risk of recurrence is much lower if we use mesh versus if we don't use mesh. There are some non-mesh repairs, but the recurrence rates tend to be anywhere from about 5 to 10% higher without mesh than if you use mesh. So if you think that you have a hernia, you should get checked out by your primary care physician.
Like you said, don't put off having a hernia checked out and learn more about repair options. Make a screening appointment today. For more information, call 816-228-5900 or go online to stmaryskc.com.